Welcome to our Healthcare Consumerism webinar. We're going to be talking about 3 different topics. This is the first in a series. The first topic is going to be understanding your health plan. My name is Jana Dalton, and I'm here with my colleagues,
Jeff Kanarowski
and Joanne Trainer.
As 65% of our groups have now migrated over to a consumer-driven health plan, more people are having to develop skills in becoming healthcare consumers. Signet offers a lot of tools to allow you to follow the progress of your claims and ways to get more involved in your healthcare experience. While these tools can be very helpful, it can be a bit overwhelming if you don't know where to go and when to go there. We want to help you better understand the tools available at your fingertips so you can become a more confident, and even savvy healthcare consumer. This presentation will touch on ways to become better consumers, but let's first start with why. Why should I want to become a better consumer of healthcare?
Well, first of all, when you're better educated about the costs of the services and your prescriptions that you're getting, you'll be able to find the lowest cost options and find the best level of care for your actual situation.
And I agree, Jeff. The more knowledge that we have of our health plan, how it works, and the tools available through mysignet.com, we will become more informed about decision making to find a facility that may be lower costing to have an MRI versus a hospital, or to engage with your doctor regarding switching to generic drugs versus a more expensive brand name drug.
And making these decisions, certainly with the quality of your healthcare involved, but also entering cost into the decision, it can help to steer the market costs of facilities as well as prescription drugs.
Yeah, if everyone in the country started asking these questions about the cost and the quality of their prescriptions and their medical services that they need and utilizing healthcare accordingly, then healthcare costs in the country could come down, basically just reduce the supply and demand equation.
And by engaging with our doctors and become a partner in our own health care, we can become more informed about ways to prevent illnesses and also to help manage chronic diseases.
So certainly, yes, learning more about preventive activities such as exercising more and improving your diet, becoming more informed about how you can make personal decisions that can curb the onset of chronic diseases, so hopefully it'll prevent you from getting sick in the first place, and then certainly lessening the chances associated with those of needing more surgeries and long-term prescription drugs.
Yeah, and part of the consumerism equation is knowing what your options are and finding lower cost options for providers. I remember being in a meeting in Concord with a bunch of employees, and one was talking about how expensive it was to get a lab done at the hospital, thinking that was their only option, when another employee piped up right then and said, well, if you look on mysignet.com, you can find that there's LabCorp facilities in Concord. There's one right up the street, and it's a much lower cost option. It was great to see that those employees were kind of coaching their colleagues to find a lower cost option.
And I agree, I've had the same sort of experiences being in open enrollment meetings, and it's really nice to see. And I think also year after year that we see that people are becoming savvier, and they do know a lot more about their health care, and making a vested interest.
Yeah, there was a gentleman I met in Raymond, and he had done some research. He had to get an MRI done on his knee, I believe, and he did some research on isignet.com, found that there was a local facility about the same distance away from him as the hospital was, and he decided to go there. It cost him and his plan a lot less money to get that MRI done. He had a very pleasant experience. It was brand new equipment, and he was very grateful that he knew about that and was able to make a decision in that regard. So as people do become more consumers of their health care, I know we are hearing more and more questions about exactly how does the plan work? How can I understand the different phases of the plan and making sense of your deductibles and the terms of coinsurance and out-of-pocket maximums? So we'd like to go into some more detail about that and help make sure that you understand how those 2 phases of your plan work and add together to equal your balances and your
out-of-pocket cost.
Okay, so starting with deductible. Deductible always seems to be pretty scary the first time folks hear it, but it's not a new term. And if people own cars, if they have a house, they have deductibles. They're just not realizing, and maybe they've not had the need to use it. They've not had an accident or had that tree fall on their house, and so had to call their insurance and realize that they have to pay the first portion of the deductible. So it's the same concept, the same principle. So the deductible pays the first portion of coverage, and that is paid by you, the insured, and it's paid at the claims are assessed at 100% of the Cigna contracted rate. So there is a billable rate, there's a billed rate that a doctor, does submit to Cigna, but because they've agreed to this negotiated discount, it's a lesser amount as to what you would pay of that 100%. During this phase, let's just say, for example, you go to the doctor's bill is $300, but the contracted rate is $150. So that is what is going to be applied to your deductible. So you may get a bill, but always remember to check that explanation of benefits to make sure that you are paying exactly what you owe.
So after the deductible has been met, then you have what's called coinsurance. And coinsurance is when the health plan will pay a larger percentage of the cost of the claim, but then you have to pay a small percentage as well. On medical services, the plan will pay 80% of the Cigna cost. You'd be responsible for 20% of that cost. And for a prescription, the plan will pay 90% of the cost of the drug, and you'd be responsible for 10% of the cost of the drug, but no more than $75. So those really expensive prescriptions, you're not going to be paying 10% of the full amount. You'll pay 10% up to $75, and that would be the cap that you'd be responsible for.
You would continue to pay coinsurance up until potentially reaching your out-of-pocket maximum. This is the most you're going to pay out of your pocket for the plan year. So it's the culmination of your deductible and then your coinsurance. So when and if you reach your out-of-pocket maximum, that means you will no longer have out-of-pocket expenses. Any covered medical or prescription drugs at this point forward for the rest of the plan year will be covered 100% by the plan. Now, another way for you to be able to keep track of this information on your own is by using the tools available at mysignet.com.
Yeah, mysignet.com really has a great deal of information for you. You can track all of your claims and balances and information about those claims and how much was charged and how much you owe. So it's really important that you log on to mysignet.com before you pay any bill and review the claim, you and your family members, whether it's a medical claim or a prescription or a dental claim if you're on a school care Signet dental plan. You look at that explanation of benefits and see what the charges were, and then what amount you may actually owe out of pocket if it wasn't covered by the choice fund for you.
Okay, another tool is estimating healthcare costs. What you can do is on the website is actually enter in a procedure. So maybe you're looking for an MRI on your knee or your back, or you want to find out the cheapest cost of a prescription and where is the best retail pharmacy that you can go to drive the deepest discount. So you can use it for all of those kinds of procedures in medications as well.
Also, you'll be able to find a doctor, a dentist, or a facility. And when you're logged into MySignet, it knows what plan you're on, so it'll be able to discern what plan that you are and what providers are in your network. So you'll be able to search in network providers to be able to determine whether your current provider is in network, or to be able to search for providers within a certain geographic area to determine who you might want to go to who provides in-network providers. Also, from this menu, you can access telehealth. So if you do have a doctor's appointment, you want to take advantage of the convenience of using telehealth for replacing really a doctor visit. If you have the convenience of doing that from your own home, you'd be able to find telehealth under Find a Doctor, Dentist, or Facility menu item.
Are there certain times when you'd highly recommend participants to log on to mysignet.com?
Absolutely.
Absolutely there are. The most important time really that you want to go on is in the springtime to complete your health assessment there on mysignet.com, especially if you're on the yellow plan with a choice fund. By completing that health assessment between June 1st and July 31st, that activates the choice fund for you and your family.
Okay, and another reason or time that you would want to go into mysignet.com is when you get a bill from your doctor. So you don't want to automatically pay that bill because I want you to realize that it generally takes about 2 weeks for the claim to process through Cigna. So you may get the bill 5 days after you walked out of the doctor's office. So don't pay it until you can see the explanation of benefits on mysignet.com that they match and that it shows exactly what you should be paying.
Yeah, I would definitely echo that, Joanne. I get many calls and emails from people asking why am I getting a bill because I have a choice fund, and What's happened literally is that the claim hasn't processed through Signet and paid, but the provider has sent out a bill to the patient. So it's very, very important that you log on to mysignet.com, look at the explanation of benefits before you pay any bill out of pocket.
Signet also provides a free app that you can download to your iPhone or your Android device, so you'll be able to track all this information right from the convenience of your smartphone. So another thing that's available that a lot of folks take advantage of are flexible spending accounts. These flexible spending accounts can certainly complement a consumer-driven health plan, but sometimes it causes confusion because people aren't sure when they use your flex spending account card or when they should just use their Signet card. So we want to go through some of those details and help you understand how the dynamics work and which should be utilized first.
Before we actually talk about flexible spending accounts, just remember that's a separate pot of money from what the choice fund is. And I know at least 60% of our folks who are on consumer-driven plans have the yellow plan with the choice fund. And that's embedded. It's an integral part of the choice fund account. So, and that gets used up first. So you never want to pay claims until you know that everything's processed through Signet and that all of your choice fund dollars are used up first.
Yeah, so to use an FSA or a flex spending account, that is actually like another pot of money, or when you reach into your own pocket to pay for a bill. So after the choice fund has been exhausted and you get a bill and you know you owe that money because you've looked on mysignet.com, that's when you can use your flex spending account. It's external to the plan. You can use it for any eligible medical expense, eyeglasses, dental expenses, etc. But know that only charges that apply towards your out-of-pocket maximum when you pay for them on your flex card are going to apply to that out-of-pocket maximum. If you get eyeglasses or dental services that don't accumulate towards your out-of-pocket maximum, then it's not going to count, even though you've used your flex to pay for it. You can use the flex account to pay for any eligible medical expenses, but you just need to keep track of which are going to apply to your out-of-pocket and which don't.
Right. And to echo that, sometimes I remind people, look at your summary of benefits. If the service is on the summary of benefits, it will contribute to your out-of-pocket maximum. Otherwise, it doesn't.
Yeah, good
Absolutely.
point.
Yeah, and a lot of people try to figure out how much money they should put on their account. We get asked all the time, how much should I put aside? It's really the best way for you to just use a conservative estimate of how much you expect to spend out of your own pocket. There are some tools on MySignet where you can pull up a report from last year's expenses and get a sense from there, so you can get an idea of how much you spend on your medical expenses, but estimate conservatively.
Right, and the flexible spending is a great vehicle to set aside funds because personally I feel to try to manage a high deductible health plan without an extra pot of money on the side or some kind of savings, whether you put it in a savings account or put it on a flexible spending. It's really an important vehicle. Okay, so to use the flexible spending account, the election is made on a pre-tax basis, so you will avoid both federal and FICA taxes. The average tax savings would be $27 for every $100 that you set aside in a flex spending account. Please note this is very important. Elections are not automatic. So every year you must re-enroll. I've actually witnessed people saying, why do I have to fill this out every year? I do the same amount every year. Why can't they just duplicate it? It's an IRS regulation that you need to fill out a new form every year in order for your employer to deduct this money. So it is a requirement. So make sure you make that election annually.
Yeah, so one great thing about the flex spending account, though, is the full amount that you elect is available on the first day of the plan year for your use. So if you had selected $2,000 to be put aside on your flex, then that full $2,000 is funded the first day of the plan year, and then it's deducted in equal installments throughout the payroll year from your payroll. If you end up paying out of pocket, you can always get reimbursed from your flex spending account just by submitting a form, and the forms are usually available off the administrator's website.
Excellent. And generally you get 2 debit cards is usually what's given away, and you can use your FSA by the subscriber, your legally married spouse, and any dependents up to the age of 26. So there are some action items. You can tell as you're becoming a consumer of healthcare, there are certain things that you have to do, actions you need to take. So we're going to talk a little more about some of their actions. Jeff, what do you recommend people start off knowing what they need to do?
Well, the first thing that you really need to be aware of, especially if you're on the yellow plan with the Choice Fund, is to log into mysignet.com each year during open enrollment season between June 1st and July 31st to take that health assessment to activate the Choice Fund for you and your family. You have to do that each year during that time frame.
And again, remember when you do get those bills from your providers, always, always, always check your explanation of benefits first, either on mysignet.com or to use the app on your smartphone.
And using those two devices as well, the Signet.com and your app, track your deductibles as well as your out-of-pocket maximum, so you can keep an eye on how your balances are tracking throughout the year, and you'll have less surprises knowing where your deductible, when you've met your deductible, and when you're meeting your out-of-pocket maximum.
Yeah, another real good resource for you to use is the School Care Wellness Portal. Log in through the schoolcare.org website, look for the Good For You link, and click on that, will take you right to the login portal. There you can participate in any of the great wellness programs, because prevention can definitely have a positive effect on your overall health and well-being, and that's definitely what we want.
And don't forget to utilize the flex spending tracking website from your plan administrator's site. You want to make sure that you're tracking the balance on your FSA, and also to use it as a planning tool for the following year. Maybe you didn't add enough or you put too much on, and you can make those informed decisions as to how you should plan for that for the future.
Thank you so much for listening to our presentation. We hope you've learned some new tips on utilizing the tools available at your fingertips. If you haven't already used some of these tools, please do so right away while they're fresh in your minds. While you're at mysignet.com, please explore other options there as well. There are a lot of other tools available that you may also find helpful. You are becoming a student of healthcare consumerism, so have patience with yourself as you learn. You may not have chosen this education, but it will serve you well as you develop a deeper understanding of your healthcare situation. Now note that there will be another webinar coming up, webinar number 2, and it will be talking about becoming your own advocate. So please tune into that as well, and have a wonderful day.